Hi, so I introduced Jess. She's in her third year. She's looking at the experiences and needs of parents with psychosis and those of her children. And she's doing a range of studies, qualitative and quantitative. And today she's going to present some data from the CRIS.
Yeah, as Louise said, my name's Jess Radley. I'm in my third year at the University of Oxford, and my PhD is looking at the needs and experiences of families affected by parental psychosis. So before I launch into my results, I'll give you a bit of background. So what's psychosis? And there's lots of definitions, but I've just taken this from the NHS website. So seeing or hearing things that aren't there, which are called hallucinations, and believing things that aren't true, which are called delusions. And there's a wide array of diagnoses you can have if you experience psychosis. You can have a diagnosis of schizophrenia or schizoaffective disorder, where there's a mood component, or a brief psychotic disorder. And how many people with psychosis are parents? It seems from global estimates that more than a third of those who experience psychosis are parents. And the impact this is going to have on these families is that the positive symptoms may mean the parents are overly involved in them, not as attuned to the needs of their children. The negative symptoms or side effects from antipsychotic medication may mean they're emotionally unavailable with blunted affect. Hospitalization may mean they're physically and practically unavailable to their children. And there's indirect effects on these families. This population is more likely to be affected by stigma, poverty, isolation, unemployment, single parenthood. And the children, when they grow up, are more likely than children without parental mental illness to develop their own mental health problems. So my PhD has 4 key components. And last year, I presented the results from my qualitative work and the design for my ESM study. So this year, I'm going to focus on my work with the CRIS network and some initial findings from my scope and review. So this is a fake example of what a patient's care notes might look like. So what CRIS is that it's a database which holds anonymized NHS records, and it contains structured fields where you can search for things like diagnosis, inpatient stays, accommodation, smoking status. It's also possible to search the free text notes of CRIS for certain keywords. And the important thing to note is that just because of the structured field doesn't mean it's been completed by a healthcare professional. So my aim was to use these administrative records to look at the proportion of parents within a sample who have psychosis. So that's the first question. It's how many patients within an NHS trust with a diagnosis of psychosis have a child. The second question is, what proportion of the children are recorded in the correct field, in the correct structured field of their parents' clinical notes? And the third question is, what characteristics are associated with being a parent when you have a diagnosis of psychosis? So this is how I built my sample. So you can see that in this NHS trust, there were 5,173 patients with psychosis. And then when I looked in the structured field for their children, which is the contact field, 824 people had children or were parents. But that seemed like an underestimate. So I took the rest of them and I did various searches in the free text notes. For example, the phrase no children, where I could confirm that around 500 definitely didn't have children. And then I searched the rest of them for the phrase son or daughter. And from this, reading about 2,000 notes, I found a further 1,182 parents in this sample. So in total, this number plus this number, that's 2,006 parents in a sample of 5,173 patients with psychosis. So to answer the first question, that's 38.8% of patients with psychosis had a child. And then with the second question, well, from the slide before, you can see that more parents were identified by me reading their free text notes and their structured notes. So that was 41% of parents had their children correctly recorded in the structured fields, but the other 59% were identified by reading free text notes. And the reason that's important is because these 59%, it means their children are invisible to anyone reading the patient's notes. And the third question, what characteristics are associated with being a parent with a diagnosis of psychosis? So I'm just going to quickly talk about 4 of the characteristics which differed between parents and non-parents in the sample. So looking at gender, you have women on the left-hand side and men on the right-hand side, and it's clear that women were more likely than not to be a parent in the sample. men, the picture is completely different. There were far more non-parents than there were fathers in the sample. And there are two reasons for this. It might be around the opportunity to have children. It might be that we already know that more parents with psychosis had their first psychotic episode after becoming a parent rather than before. And we know that psychosis has an earlier age of onset in men. So it might be that elements related to psychosis, such as poverty and isolation, may provide men with fewer opportunities to have children. But there might be a second reason. It might just be that fathers are under-recorded. So we know that parenthood is recorded when there's a mention of children, so in the structured field or when it's talked about in the free text notes. But healthcare professionals may be less likely to ask men about their parenthood status, or men might not have contact with their children, be less likely to talk about it. So it might simply be that their parenthood status was missed. The marital status, it's quite clear that anyone who was married or who had ever been married was more likely than not to have children, and the picture is completely different for the single people in the sample, and this is around the opportunity to have children. Then with accommodation, those who were owning were more likely than not to have children. The picture's different in those who are renting, but the difference is less than those living in supported living, or in this other category, which included bail, prison, rehab, and inpatient ward, being homeless, sofa surfing, squatting. So again, it suggests that those who have a more settled lifestyle have had more opportunities to have children. And then finally to diagnosis. So this is just slightly different. It's the parents versus non-parents, a proportion in each diagnostic category, because there are loads of people with this F20, so you wouldn't be able to see everyone else. And these are the codes over here. So yeah, so F20 is schizophrenia. And you can see when you look at F20, compared to all the other diagnoses except these two, those with schizophrenia are less likely to have children than everyone else. And this might be because in order to be diagnosed with schizophrenia, both positive and negative symptoms must be present. And individuals with schizophrenia are also more likely than those with another psychotic disorder to experience cognitive symptoms and for those symptoms to be chronic rather than episodic. So the differences between the diagnoses may reflect that a higher symptom severity can lead to fewer opportunities to meet a partner and have children. All right, so I'm going to move on to my scoping review. So I started with my PhD with a systematic review with Cochrane, and that was looking at the evidence base for parenting interventions for parents with psychosis. The scoping review is much more broad. It's looking at any parenting interventions that have been designed or tested that would benefit parents with psychosis. So the similarities are that they're both looking at interventions designed to improve parenting skills or the parent-child relationship, and it's looking at the same age range for children. But the difference is that the scoping review is looking for any kind of study that describes an intervention. It might not even test it, and so it doesn't need to be a randomized control trial like in the first one. It's looking at any intervention that'd be appropriate for a parent with psychosis. So it doesn't need to be the case that 50% of the sample have psychosis. It can just be that they're not deliberately excluded. And it's looking at more recent papers. So these are kind of my first stages. I'm going to be searching elsewhere too. So from about 20,000 returned records, I identified 31 studies that were described by 86 reports, because there are sometimes multiple reports on the same study. And globally, it looks like Australia is doing great for parenting interventions. The Netherlands is doing good too, and Scandinavian countries. The USA is doing quite well, and the UK is catching up. Something I wanted to note is that because I only included publications in English, it looked like there were much more going on in Germany, but I just couldn't describe them because I can't speak German. And we might try and get someone who can speak German on, so the review is a bit more representative of what's actually going on. So I'll just quickly talk about two before I finish. So one intervention was called Family Options. It was quite intense. It was for a whole year, and the family coach, who had a degree in psychology, would go into the family home once a year. It's for all the family members, and they'd provide anything really: emotional support, practical support, goal achievement, and a 24-hour crisis service for these parents. And the findings initially seemed to be positive. A different intervention was called the Chin Up Parents in the Netherlands, only for parents. And it was actually online, 8 sessions, and the sessions were very specific, very tailored, as you can see. And this also had initially promising results. And so I just wanted to quickly highlight the publications that have come out of each of my parts of my PhD. And then just to say thank you very much to Mental Health Research UK and my supervisors for supporting me through this. And yeah, you can get in touch with me here or follow me on Twitter. Thanks very much.